Okay.
Hi, everyone who's joining us. We're going to just wait a few minutes to start so that everyone can enter the room and log in. Thank you for joining today. Hey, everybody, we're going to just wait one more minute for a couple more people to join, and then we're going to start. Thank you for your patience. Good morning, everybody, or afternoon, depending on where you're calling from. Thank you for joining us here today for the COVID-19 and Indian Child Welfare webinar. As members, it's super important for you to be able to share in resources like this and also to provide your feedback. We'd love to hear what you have to say, your thoughts, and please feel free to reach out using the chat feature. We also have the ability so that you can raise your hand so we know who wants to talk. We're going to be going through some material with David Simmons, who's the Government Affairs and Advocacy Director at NICWA. There will be an opportunity at the end of the webinar to ask questions directly and to kind of put on the radar what you find important and what's compelling to you. Thank you again for joining us today. I'm going to pass it off to David.
All right. Well, thank you, everybody, for joining our call today. We've advanced slide, please. Okay. We are embarking on this webinar with really what I'm sure all of you are aware of. This has been a very, very quickly developing issue here, and it's taking root all over the country and in Indian country too. I know that there are at least half a dozen, I think, confirmed cases of COVID-19 involving Native people in Indian communities, and probably those numbers will change. But we knew as things were starting to develop, we started to talk amongst ourselves at NICWA about what we imagined might be some of the implications for tribal child welfare programs and urban Indian child welfare programs. And so we are committed to providing as much information and resources as we can over the next several months on this issue. And as part of that, as our partners in this, we also are going to be very forward in saying that we need your help too. So we want to know what's going on the ground for you, and what are some of the things that we can do to help you as well, and what kind of resources can we help focus on. So this is our kickoff for this. This is the first, so this is not going to be a one and done kind of webinar or exchange with you. So we're going to be doing more of this later. But we wanted to at least get the start, and mostly what we're going to do today is talk. I'm going to share a little bit of information about what we're learning from others around us in terms of what child welfare impacts are looking. And also I want to engage you at the end of this presentation in a conversation. I'd like to hear what you're thinking about, what kind of things you're seeing or experiencing on the ground, your concerns, so we can start collecting that information as well to help you. So I'm going to just say that, first of all, we want to let you know that we are focused on not just one particular part of child welfare. We're focused on all of child welfare. So we're thinking about programmatic issues. We're thinking about the staff who are rendering the services, managing the services. We're thinking about the children and families and the caregivers too, who are taking care of the children. And we're also thinking about your partners, the states, the counties, private providers, other tribal programs too. So we're trying to think about how we can integrate and provide information that will help you in your communication and efforts as well. The other thing I want to let you know is that as we enter into this work, we've already been, for at least 2 weeks, NICWA has been working with and talking with different tribes around the country about what they're starting to see. So we haven't had a chance to do a lot of those calls, but at least with a few child welfare directors. We've also been talking with national Indian organizations a lot. We're spending a lot of time, as you might know, NCA, National Congress of American Indians, and National Indian Health Board and others are very engaged in the process to develop policy solutions and funding solutions to deal with COVID-19 in tribal communities. And so we're trying to provide recommendations or ideas that we have and bring other people into the conversation. And we're also engaged with our non-native child advocacy group partners as well, like Child Welfare League of America, Children's Defense Fund, Generations United, and members of Congress too. We're talking with them because there's going to be a series of bills that are going to come forward. There's already been 2 that have been enacted just in the last less than a month. And we're expecting, right now Congress is working on yet a 3rd bill, and this will be the biggest bill. The first 2 bills, the very first bill was passed as the first response from Congress, and that had about $40 million for tribes. Now, those funds haven't actually gotten out into communities yet, but they're coming soon. It's primarily going to be focused on the health response by health providers in Indian country, I believe. The second bill actually looked at more broader implications. That has just been signed by the president, I think, today or yesterday. And that one is looking at some other things like income assistance and some other health issues, unpaid sick leave across the country. So still broader issues. There are some things in there for tribes, but they're not at the human service level. So this 3rd bill, they're calling it Phase 3, is really the bill that's going to have more of the human service focus as part of all the other moving parts of it. And we're trying to get specific requests in there to help you get more resources too. And this is, whenever Congress comes together like this, they have to, the rules that they use and the process they use is very expedited. They set parameters and timelines. So if we can't get some of these issues addressed in this larger bill that's being developed right now, what we will do is we will continue to make sure that at least in following bills that we can do more of that. And so, like I said, the more information we can get from our members and our constituents, the better our advocacy will be as well. And we will talk to you about what that looks like and how you can be involved in that too. Next slide, please. So this slide really talks about some of the bills, gives you the numbers. The first two at the top are the ones that have already been enacted now, and it mentions the third bill. At the very bottom, you'll see here are the three requests that we are trying to put forward right now. And let me explain each one a little bit. So the first one is increasing on-reservation ICWA grants by $20 million. So one of the criteria for getting money out quickly to deal with COVID-19 is that the money needs to be in a program that's already authorized, that is part of, is a program that many tribes have access to, not just a few. And it's the kind of program that has flexibility in its purposes so that it could fund a lot, sort of a wide variety of issues. What we've said about this request for $20 million of extra ICWA funding, and by the way, $20 million is equal to the amount that we see as annually as what goes to ICWA appropriations for these tribal programs. So we'd be doubling that. But we're saying the things that we think will be needed and ICWA can help with additional funds are things like respite care for care providers, kind of emergency case management for children, families, caregivers who are impacted by where children are in out-of-home care or at risk of out-of-home care. So that could include things also related to the safety measures that frontline staff need to take to be safe as well. We're also anticipating that there are going to be probably some placement disruptions based on COVID-19. If you have placements or families that have members who are actually quarantined based on COVID-19 exposure, we know that we can't just move children in and out of homes that easily. Foster care children have different needs than just other children, and so there's a different kind of process. So we know we're going to probably see some placement disruptions, including in institutional care, residential care. And the third area that we're also thinking about is sort of what's it going to look like for the income of care providers. So we know that our care providers, for the most part, are people that are volunteers. I mean, they're doing this. They're getting some resources to help pay for the expenses related to children, but they're not being paid themselves. And we want to make sure that if there are children who are in care and their care providers lose work, employment, reduction in hours, or things like that, that we have the ability to step in and be able to help supplement their income while they're providing care so that there aren't disruptions in placement there. So, all of this really focuses on continuity of care for children and child welfare so that we're not increasing any kind of trauma or distractions in their lives that don't need to be there. The second increase that we're looking at is increase of about $40 million for child care. So CCDF stands for Child Care Development Fund. This is what used to be called the Child Care Developmental Block Grant. And there are about as many tribes who have child care programs funded under this source as there are tribes who have ICWA programs. So it's a very large number. And we know that, again, in child welfare, we've got a lot of care providers, and they're going to need care. And we're going to see people who are possibly maybe at a lower level risk for child welfare involvement. But if you take away things like their ability to have child care, this could increase the chance for neglect, children being left at home alone, things like that. So we think child care is a critical piece of this. And from what we're hearing in Congress, a lot of advocates are also thinking along the same lines. I know Senator Chuck Schumer has in his package a line item for increasing child care very significantly. And the third area is the BIA Child Welfare Assistance Grants. This is sort of the umbrella program. Not all tribes have this program, but certainly tribes in non-public law 280 states often do. And there are a number of things under this program. There are programs like general assistance, which provides income to people who have lost their jobs. There are emergency assistance services for things like floods and natural disasters. We're not sure if this would COVID-19 will fit under that program, but certainly it's an emergency situation. And there's burial assistance, and there's also non-custodial and health-related care for adults as well. So all of these are really, and child assistance. So all of these are really important, again, to providing support to families, especially in times of high need, like what we're starting to see happen because of COVID-19. So these are the requests we've started with, but there may be opportunities, and we may need to make additional requests too. So we'll want to be monitoring and advocating on this process to make sure that our policymakers know what the needs of tribal human services folks are. Next slide, please. So we've been doing a lot of reading and talking to people, we've started to put together a list of places in the child welfare system where we think that there could be some challenges or concerns. And so I've put together this list in consultation with a number of our partners and just through some of the reading and things I've been doing and talking with some of you as well. And so I wanted to go through these things just to kind of highlight some of this, not because this is an exhaustive list, but this is sort of the first try in trying to think about where some of these are. And these needs are, of course, very directly related to what would happen in your community if you had children who were part of the child welfare system or their families affected by COVID-19. And it doesn't mean that they themselves have to actually have been exposed to COVID-19, but that they might even have a risk for it. So we're looking at that. We know lots of places are putting in policies and procedures for how to keep people's exposure low. So all these things are going to have an impact. So we're starting kind of at the beginning here with investigating maltreatment. So, as we're getting child protection services, obviously has to go out, has to lay eyes on children and families. They have to be able to do their investigation work. And so there's some issues related to how they're going to be able to maintain. I've gotten a little bit of information that leads me to believe that, we have a limited supply of medical kinds of supplies that could be used for people who are in contact with people who might have COVID-19 exposure. And right now, even medical staff are not having access to all of the equipment and supplies that they need. And what I've heard in a couple of places who are thinking about this, like child protection services, is that they're being told that the medical staff may have first access rights to those supplies first before others do. So we want to continue to monitor that situation because obviously we can't stop investigating child maltreatment. The other thing is that we could see situations where increased numbers of children might be left home alone, children being sick, children having parents who need to be hospitalized or having to go to work because kids are out of school and leaving kids home. And of course, these would be neglect cases, and we know that neglect cases will be investigated too. And so we want to think about how is this potentially going to be an issue, and how would we address that? Nutrition for caregivers and children. One of the things that I'm sure some of you have already experienced is you go to the grocery store and the shelves are empty in many parts of the store. So, there's possibilities that there could be supply line disruptions in trying to get food. And right now, we've been told by USDA that SNAP programs, tribal commodity programs will not be disrupted, but we have to think about that, especially when we have children who have been in school before and getting meals who are now at home or with caregivers, and so they're not getting those same school-hosted meals or sponsored meals. So that's another question we have. In-home services. Of course, we need to have eyes on children. A lot of times these are voluntary services, and families are engaging and thinking about what kind of support do family members need to be able to continue to work on the issues that they've been working on, regarding child maltreatment risk, but at the same time, what are some of the things that they might need to help develop a plan in the home to help reduce exposure to COVID-19, whether it's social distancing and other kinds of activities. Substance abuse treatment, of course, is a big issue for a lot of our families in the child welfare system. We're thinking about treatment services challenges and disruptions there. We know that that SAMHSA just recently said that that they believe to maintain social distancing and quarantine things that they could and isolation procedures, that it would be that people could be excused from treatment who are experiencing substance abuse issues. I think that we want to think about that in a larger context, not just thinking about how does this affect the treatment plan, but how does this affect other members in the family too, and the children as well, and thinking about how this might impact situations where you're in court and you've got other kinds of milestones coming up where review hearings are happening or decisions in court are being reviewed and developed. So we want to be clear that we don't want families, of course, to be held responsible for not being able to succeed if they don't have access to services. And so there can be some challenges here, especially inpatient treatment services too. And so we're thinking about that. Visitation and reunification, obviously it's really critical, especially during these times, to maintain visits and services, helping with transportation. So what are the alternatives to in-person visitation if that can't happen? Can people set up Skype or FaceTime kinds of things? I know some of the tribes are doing that already, but it's something that probably needs to be looked into, because we don't want families, of course, to feel that they don't have alternatives, and that those important relationships are going to be even more distant for them, especially for children who are out of the home. Next slide, please. I mentioned court appearances earlier, but I think here is one of those things where courts are moving ahead. We're hearing about this, changes in the dockets, maybe slowing down. Courts are concerned about COVID-19. Especially state courts, I would be thinking about here is where we have NICWA cases, and making sure that they know that they shouldn't be making decisions without the tribes involved, from the children that they have on their docket and the families. So that could be a really important communication to have with state courts, even in tribal courts, helping courts understand what the challenges are in your own system to service delivery and how that might impact hearings and decision making. So that could be an important conversation to have. We've got, of course, a number of children and youth in the child welfare system who have special needs. They're medically fragile. Their caregiver supports, especially if they have older relatives like grandparents, might have certain developmental, where we could be looking at physical needs that go beyond sort of the average person. So thinking about how we make sure that we're tracking what's going on with those families and homes. Caregivers, of course, related to that, they've got issues. They're going to be feeling the stress, like all of us, around COVID-19, and probably be wanting some more support. Healthcare access will be important for them. Employment, of course, so that they can continue to be the caregiver. So thinking about how we can do and support that. And I thought about, in family team conferencing, family group decision making, where we're bringing families together. Now, this could be impacted too, because maybe it's not a good idea to have 10 or 15 family members in the same room together where we can't practice social distancing. So are there ways to help continue to have those kind of conversations, even if it's through conference call and things like that, and supporting the caregivers in those situations? I mentioned earlier for children in care that there could be disruptions to placements. one of the things we're hearing about institutions is that, these group care facilities that have more than, 5 to 10 children or youth in them are really scrambling, trying to figure out how they're going to address the need to reduce exposure to COVID-19. I talked to one child welfare director who had said that they had already received a call from an institutional setting where they had 1 or 2 of their youth, and that they were being told that the institution may have to make some changes, may have to move some kids out, and so they were getting some pre-notice, I guess. So I think, in any country, there are not a lot of group facilities to begin with in communities. So we know that for the children who are placed, the Native children who are placed in these facilities, they're often out, quite far away, maybe even 1 or more states distance from where the community is. So we just it's thinking about how we help form the partnerships with and communication with those out-of-home placements, so that we're able to make sure we know what's going on with children, and that if there are issues and the kids need to be moved, that we can do that as a smoothly process as possible. And that also goes for, of course, just in-home or in-community placements related to foster care. There's going to be a need to do maybe some additional recruitment and licensing work, possibly replacement. So thinking about how can we make those processes work better for us? Are there ways that we can do things while keeping children safe that don't require maybe quite the same amount of time, given that we have fewer days to work with when we've got a COVID-19 situation? Next slide, please. Relative care, thinking, of course, relative care is such a big part of the caregiving system in Indian communities. Older caregivers, thinking about them, and I'm thinking about some of both the social isolation that they might feel, but also the support that they might need to also deal with children in their home who have higher needs themselves. And so if we've got older caregivers who are just by definition at higher risk of exposure to COVID-19 and more severe symptoms, how can we make sure that those caregivers have the kind of support they need? Do they understand, do they have access to the kinds of information that they need to be able to put into place to protect them and the kids in their care? And do they need additional supports maybe that they don't currently have in the home? Another group that is like kids in institutional care who are maybe not there in the community is foster youth that have aged out. So a number of our older youth that have aged out are, maybe going to college or going to some other schools, and where they're living and going to school there. Some of them may not be in colleges, but might just be living sort of interdependently and have employment, but don't have the ability. They're living kind of paycheck to paycheck. So with the colleges and schools closing their dormitories and things, well, we are hearing that there are many schools that are doing this, and they are providing for some students to be able to stay on. But the message, really, the big message we hear is that you need to relocate. And for many of our foster youth, former foster youth or current foster youth who are aging out, they may not have a place to go, and especially not quickly, and not have the resources to be able to make that move. So we're thinking about all of the different services that they would use, even on just a regular, but also needing to be able to get those into play as well if they have to if they get displaced or lose employment. And lastly, I mentioned here, I just set out NICWA cases as its own bullet. I'm thinking about how in these kinds of times when state systems are also struggling and trying to figure out what to do to protect kids and families in the foster care system and child welfare systems, and so are the courts. So I think the communication and understanding, make sure that the case management is happening and that we're not losing sight of NICWA requirements in that, and the role of tribes as helping co-case manage and sometimes providing services and referral to services, and also being part of the support system for many of the children who are in out-of-home care and their caregivers. So making sure, just touching base maybe with state systems to make sure that they understand what it looks like on the ground level in tribal communities where all of these children come from. Next slide, please. So a few things that you may have seen in the announcement. I've just kind of summarized them here. The announcement for this webinar that we put together. These are just sort of the beginning places to start, but some ideas that we had. So first of all, I think people are still hungry and needing accurate information on precautions to avoid exposure to COVID-19. I think most people have know about what COVID-19 is. They know maybe a little bit about washing your hands, but if you think about our daily lives, especially when you're taking care of children, there's so many touch points that need to be addressed about, what kind of surfaces would be more likely to host COVID-19 virus, what does social distancing mean for younger or older kids in the same family, other things. So there's a lot of questions that I think families in general will need good information about, and what to do if a child does appear to be sick or a caregiver too. So whatever your health system looks like and how they're going to be developing at the local level, that's the kind of information, of course, the child welfare families need as well. I've had in the past, I've had the ability to talk with some state child welfare directors and even a child welfare director from a tribe about what it was like to work through a natural disaster. So the example I'll give you is we know a friend of ours, a friend of NICWA's actually, is the state child welfare director for the state of Louisiana, and she was talking to us about, at one point a few years ago, about what it was like to deal with the aftermath of Hurricane Katrina. And many of the federal programs like Title 4B require natural or disaster preparedness or emergency preparedness plans. So those might be something that you want to dust off here and take a look at. But one of the things that we learned from talking with folks like our friend in Louisiana was that it's really important to know where the kids and families are, because if things get much worse in the community, you can expect that some people will have to leave the community, maybe to be quarantined or getting services in another area. And we want to make sure we know where kids and families are at all times. So creating a master list of children and families, kids in out-of-home care, families you're working with, is really critical, I think, at a time like this. And then making sure your face sheets and your case records are updated. You may have staff who are going to get sick possibly, and if that happens, you'll want to make sure whoever's stepping in, they can just open up the case file, look at it over there on the left-hand side maybe, or the front cover, and see on the face sheet what are all of the medications that children have, where's the placement, what are the contact phone numbers, what kind of other medical information is there. So making sure that you have that information there so you know where kids and families are, and you know how to be, in case you have to move case management around, you can have case records that are easily accessible and people can get information that they need quickly. Planning with parents and caregivers, another area where we know that there's going to be some additional needs. I think we're not saying exactly what the planning would look like, but we know that just checking in with parents and caregivers about how they're dealing with the COVID-19 issues and what they're doing, giving them some more resources to tell them about. So, if you sent somebody sick, please give us a call, and reassuring people that there's no penalty for people being sick or or if they lose their jobs and things like that, but that we just want to help and support you. So that will be I think, important. And helping kind of ease the impacts of social distancing. So for some of you, you might be working from home. I'm sure many of you aren't, but if you were working from home, you'll know that after a while, especially in homes where kids are used to talking with their peers and kids at school. Well, they're not in school. That's a peer support system that they don't have as easily as they used to. And certainly the adults in the home can also experience that too, because they're in our communities. We have natural helping systems, or extended families are a very big part of that. And it's possible that we may see that it might be harder to access those support systems. So thinking about how we can support maybe more activities, giving families more ideas about how to do things at home within that kind of social distancing framework could be very valuable in helping support people's mental health as well. Workplace plans for keeping staff safe. We know we're going to have staff on the front lines. They're going to be still interacting with the kids and the families. So what kinds are there, other than the things that we already generally know about COVID-19, are there other things that we need to plan for, and do all our staff know what the protocols around those are? So having some kind of a plan so that people understand, and thinking about how do you share that plan with other agencies that you work with on a regular basis. And then in anticipating challenges in the service delivery and partnership. I know we can't anticipate or know everything at this point, but starting to develop a plan where you've got people in your office that are going to start communication with your partners in this work, talking with them about what are the things that you're seeing, what are you going to do, what are they seeing, how are you going to come together, what's a process for problem solving, developing solutions to challenges you have. Those kinds of communication plans, service delivery planning can be really helpful to try and lessen the impacts that you will see because of COVID-19. Next slide, please. And another level of trying to help keep kids and families safe is that we know that tribal child welfare programs are already underfunded and often overwhelmed just with their regular work. So what about trying to develop some understanding of who are the folks, like we do in child welfare in other ways, who are the folks who have the highest levels of risk? So, and here we're talking about risk to COVID-19. So, and trying to make sure that we know that we're reaching out to maybe those families first as we're starting to develop our own kind of planning and strategies. As you're developing your master list, you might figure out a way to identify what are the criteria for who would be considered at higher risk, and which of our families and our children would fall into those categories, and start touching base with them. My experience so far with COVID-19, as I've been talking with different people, is that people are doing planning, but on the front lines, people are struggling to know how to deal with a multitude of situations that come forward, and everybody knows certain families that are in children who are going to have higher needs. And some of the other helping systems like healthcare, mental health, substance abuse treatment, they're also going to be pretty engaged here too. So if we can at least keep communication with families and certainly prioritize those with the higher levels of risk, maybe it will help us avert those placement disruptions and families not being able to be successful in their child welfare work. Court systems, checking in with state and tribal courts to inform them of your challenges. We've talked a little bit about that. And then congregate care settings, asking for their plans. Most congregate care settings should have a plan, or at least the beginnings of a plan now, to think about how they're going to do this. And they'll probably have a plan for staff and for the children or youth that are or family members that are there. So what does their plan look like? Does it include contacting you if something happens or changes, if there are disruptions in placements at these kinds of places? What kind of emergency plans do they have if somebody gets sick? Who are they coordinating that with? A lot of questions here, but it would be good to share information back and forth and make sure that these groups, care settings, residential facilities know that you are a resource in this, and that they shouldn't be just moving kids for the sake of convenience, even though there's urgency here, without checking with the tribe before they do that, and possibly even knowing that you may have resources that could help support some of what needs to happen as well. One last thing I would mention about the other systems. So there's probably no better time to be collaborative than when you have a pandemic, and different systems are going to have different levels of readiness or capacity. And I think most families tend to go to the people who they feel that they have the relationship with, even if that's not exactly the system that addresses some of the needs that they have concerns about. So thinking about your role in child welfare, if you're one of those folks and you have those relationships with your families, about how am I going to pass information off to other agencies and partners so that they understand what some of the challenges are. And one example is if you have people who are not necessarily impacted by COVID-19 directly, but somebody loses their job in the home. And so all of a sudden their income is cut in half or more. And then they're looking at a situation where they can't pay their rent. And so then they're looking at housing concerns. You can kind of see the ripple effect here. So how are we coordinating with TANF or general assistance or housing in those kind of situations to make sure that they know that we don't want families to disrupt, but we may need additional supports and help, and we're communicating those as they're being shared with us too. Next slide, please. So that completes the part of our presentation where we're just trying to highlight some of the potential areas where there could be challenges or things to think about, issues to think about. Now we want to just ask for your help. We want to ask you to share with us what you're seeing at this somewhat early stage in the pandemic, but we want to understand more about what you're seeing, what kinds of things you're wanting help with, and what kinds of help do you need communicating these things, whether it's policymakers, leaders, and community or outside the community. So we've got 4 questions here. We'd like to kind of, we don't need to go through each one of these questions individually, but I want to open it up to people. And Jeremy, are we going to be able to open it up so people can, they're off of mute and they can talk with us?
Yeah, we're gonna give that a try. So if you have an answer to one of these questions, please via the chat message say which question you're responding, either 1, 2, 3, or 4, and I will try to give you the ability to communicate. So take a minute, read over the questions, and David can address them as they come up. So we're going to take a minute and give people a second to respond.
I'll also add one other thing is I know a couple people have typed in some questions through the chat, the question and answer bar. So I'll get to those too before we hear a little bit as well. If you're trying to share information and for some reason it's not, we're not hearing you, if you just send a quick message through the chat and just, let's say, hey, I've been trying to share some information, but I'm not sure you can hear me. That'll let us know if it's working. Okay, what I'm going to do is I've got a couple of questions here that I'm going to try and respond to. So I've got a question here. What are the challenges you are seeing in delivering services to children and families? Do you have any ideas or plans on how to address those? I think I covered some of those earlier, but if there are some more specific things that people are thinking about, I'd be, please type in an additional question. I'll be happy to look at that. I think I would say generally what you're seeing on the ground in your community is going to be a function of your own experience, of course, and then also the conversations you have with other people. And so one of the ways to understand more about what's going on your local level, of course, is to have those conversations. And I think it's really important at some point, hopefully sooner than later, to start reaching out to tribal leadership too, to help them understand. Now, tribal leadership are going to be focused on a whole lot of issues here with COVID-19, especially health-related issues for the health systems. But they may not be thinking about child welfare per se. And so I just really encourage you to even just have some brief conversations to say, here are some of the things that we're anticipating could happen and some of the challenges that we're going to have. So that's one strategy I have for trying to get your voices heard about this. I have another question. Says, on the Cheyenne River Reservation in South Dakota, Simply Smiles is a not-for-profit organization that is seeking Native adults all over the nation to become foster parents at their children's village. It says, recruitment has been difficult, and the current pandemic has made things all the more difficult. Any suggestions for recruiting enrolled tribal members to become foster parents at the children's village? I think the first thing to know is that the community needs to be aware that COVID-19 also impacts children in care or children who might be at risk for care. So that might be something to think about, is how do we get the message out in the community that we could use some more foster parents in case we start seeing disruptions and things like that. So I think it's important to have a reassuring message where we're not trying to scare people, things like that, but to just say, we want to be prepared. We want to make sure that we have plenty of homes for the kids that need them. And so especially during this kind of pandemic, it's important that we were able to do this kind of recruitment. I think it's also important to be able to say to people, to help allay their fears, that we have resources and we have ways to help reduce exposure to COVID-19. You might talk about we're very closely monitoring the kids that need care to make sure that they're getting support and that they're not being exposed. And so anything you can do to reassure people that if they become a foster parent, they're going to have the support they need, and they're going to help the community, and they're going to be things in place to ensure that they're not getting children who are going to be, and families who are going to be left without resources should anybody get sick. Another question here talks about what is NICWA doing to help, and what will NICWA continue, and will NICWA continue to host calls and webinars like this? Yes, we are doing. I've described some of the advocacy things we're doing. We're also trying to put together resources, and not quite yet, but we're interested, if people are interested in this, to do consultation with people if they're trying to develop their own resources locally. So we can't guarantee that we'll be able to meet all of the needs on this issue, and we'll see how it develops, but we certainly want to be available to you, even not just at the times when we're doing webinars, but also between those times as well. And so if you have questions, maybe you think of something later after the webinar, please feel free to contact us. And you've got my email, if you've got the webinar announcement, so you can email me directly. I've got another question. It says, I'm curious to hear from others. Are others on the call able to communicate with tribal and state leadership on their challenge, and what does that look like for them? Does anybody have any comments about that? Okay. All right. You guys are quiet today. Okay. If we have any more questions, I'm happy to take them.
So David, we have Mike Yates in the chat. He says that he has a little input for the first question.
Yeah, great.
So hold on one sec.
Jeremy, are you trying to unmute Mike?
Yep, he should be unmuted. And also to add, Amanda Doctor said, I work for the Nebraska DHHS, and they are instituting weekly calls with our local tribal leadership to address the ever-changing protocols and needs.
Great. Thank you, Amanda, for sharing that. And Mike, if you're having trouble being able to share your questions or your input, if you type it up in the chat bar, I'll read it out. I can read it out loud too.
Can you hear me right now, David?
Yeah,
I can. Great.
Oh,
Hi,
perfect.
Mike.
Hey, so in talking about the challenges and seeing that we're seeing in delivering services to children and families, I'm seeing an uptick in folks just not answering their phones. So it leads to me to either believe one of several things actually, but one of them is, are people isolating themselves more? Are they not able to afford their cell service anymore? Those are two of my biggest things, biggest concerns around that, and it's just not being able to actually contact them, or they're not picking up their phones.
And these are family members, right?
Family members, clients we've worked with for a while. I think that what we're seeing is a fear that we are going to bring more increased infection chance into their homes, and so maybe they just don't want us going there. Is the reason I'm bringing that up.
Okay. Thank you.
Yep. And to answer the last one, we have tribal liaisons that we can reach out to here in Washington State that are able to connect us with state leadership sources.
Okay, great. I see a question from Jill Esch from Minnesota.
So Jill said, I'm gonna unmute Jill as well. Jill, I don't know if you have the opportunity to use a microphone. I'm going to give you the ability to talk if you wish. So David, Jill is enabled to talk if she is able to, and if not, maybe you'd like to respond directly to her response.
Okay. Well, I'll read. So Jill says, aloha from Minnesota. And she says, I spoke with a mother who was concerned about her 2 young children being in shelter. So I mean, like shelter care during this time. And she wanted to have her children come home on protected supervision. I encouraged mother to speak with her attorney to see if she could contact the county and court to see if her children could come home. So I'm just going to read between the lines a little bit here, and I'm guessing that what Jill is saying is that you've got parents who are biological parents who are, of course, concerned about the health of their children, and so she's here wondering about alternative situations where children could be placed in maybe moved out of shelter care or other kind of residential facilities and moved into some kind of protected supervision at home. And I think that speaks to a couple things. One is, of course, just the fears of parents and what we do to help allay those fears. And the second thing I would be, I see here is thinking about, as we look at our caseloads and we think about different families, if we have opportunities to move kids out of shelter care or something like that and be at home under, safely and some kind of protected supervision, maybe that's something that would help both kids and family trying to move forward on the issues that brought them to the attention of the child welfare system. And the court would, of course, in these situations, because there's probably an order of placement, would also need to be involved in that. So I think that's an interesting idea. And I thank you, Jill, for sharing that with us.
So we got a couple minutes left. If anyone has anything else that they want to put into the Q&A or just into the chat, we're gonna give another minute for that. Thank you to everyone who has submitted great questions. It's really appreciated. I know that there's a lot of information out there, so it's good to have some good responses and good information to everything.
Okay. Thank you to everyone.
Okay, I think we're gonna start wrapping everything up here. This information, this PowerPoint slides and the webinar will be sent out tomorrow to participants and non-participants alike. As I said earlier, my name is Jeremy Chase Israel. I'm the Member Relations Manager at NICWA. I really appreciate people coming out and taking part in this conversation. Big thank you to David and everyone else involved. And then David, I'm gonna just pass off the closing remarks to you.
Sure. Well, thank you so much for everyone jumping on a call. I know we didn't have give you a lot of notice for this, but as we said, we make sure that we're here to support you and try and do the things that you yourselves can't do as well. And we also want to say how much we appreciate you and the work you do to keep children safe and strengthening families in Indian country. And so if there's anything you can think of that you'd like us to talk to us about or you'd like us to help you with, please don't hesitate to contact us.